welcome to the What Does Science Say channel, and welcome to the Deep Dive. This is where we take, well, a whole bunch of sources, and we really boil them down to make complex stuff super clear, hopefully compelling for you. Today, we're diving deep into something that, let's face it, affects all of us eventually: aging skin, specifically wrinkles. We've looked at everything: dermatologists, natural therapists, even old-school home remedy experts, so a really broad view. Our mission: to unpack why skin wrinkles, what speeds it up, both outside and inside stuff, and then look at the whole range of solutions, from simple home tricks to serious professional treatments. Basically, we want to give you the insights to make smart choices for keeping your skin looking healthy and, well, youthful. Okay, so we all see it happening, but what's really going on under the skin when wrinkles start showing up? Let's unpack this.
Right. I mean, skin aging is totally natural. We know that biologically. It's
Yeah.
fundamentally about skin losing its elasticity, and it gets thinner. The key players are two proteins, elastin, that's for the bounce, the snapback, and collagen, that's the structure, the firmness. As we get older, our natural collagen just breaks down faster than we can make new stuff. Think of like a trampoline losing its tightness. It starts to sag, get dimples. That's pretty much it.
That's a really clear picture. So it's collagen breakdown. But where do we usually see these changes first? Are there like early warning spots?
Good question. Often, yeah, the very first lines tend to pop up around the eyes, crow's feet. Then gradually you might notice them more on the cheeks, around the lips, the neck, and hands, definitely hands. Now, one area that's notoriously tricky, jowls.
Ah, yes.
Oh.
Jowls. Why are they so tough?
Well, it's not just skin loosening up. It's more complex. Your actual bone structure is shifting a bit. The jawline might narrow slightly. Cheeks can thin out. The eye area might widen. Plus, those little fat pads in the face shrink. And then you add the skin laxity on top. So yeah, it's a combination of things. Really multifactorial. Needs a whole strategy if you want to address it properly.
That really makes sense, the multi-level changes.
Excellent.
You mentioned before that there are sort of peaks when aging seems to accelerate. Can you talk about those?
Yes, absolutely. Based on what we see and hear, there seem to be these points where changes become, well, much more obvious. The first one often hits in the early 30s, sometimes even late 20s for some people, just subtle lines starting. Then there's a second, bigger peak, usually late 30s.
Okay.
And this one can feel more drastic. Sometimes it seems to happen really fast, like over a month or so. And interestingly, jowls, they often start becoming noticeable somewhere between that first and second peak.
Right.
Then the final peak tends to be mid-40s, and that one can feel like things changed almost overnight.
Wow. Okay, so that's the natural timeline. But what pushes the accelerator? What makes it happen faster? Any surprising things we should know about? This is where it gets really interesting, I think.
Oh, definitely. It's a mix, really. External factors and internal stuff. Externally. The number one culprit, no question, is sun exposure. UV light. It just directly attacks and damages both collagen and elastin, period. Quick aside, your natural melanin does offer some protection, maybe like an SPF 20 or 30, but nowhere near enough for serious sun time.
Right. Not enough.
Then something maybe less obvious, too much water exposure, like washing your hands constantly or doing dishes without gloves all the time. It strips away natural oils, leads to dryness, makes skin look older faster.
Didn't think about that one.
Yeah. Then you've got chemicals, maybe in cosmetics, maybe industrial stuff, even harsh soaps and detergents. Pollution is another one, and smoking, huge accelerator. The chemicals literally destroy skin cells. Even harsh tap water, with chlorine and fluoride, can be tough on skin over time.
It feels like our skin is under constant attack.
Yeah.
You mentioned those aging peaks, like getting a memo from your body. So those are external hits. What about inside? What we eat, how we live?
Yeah.
What's the most surprising internal factor people miss?
Internally. Well, one of the biggest, and people really underestimate this, is simple dehydration, just not drinking enough water.
Hmm.
Another huge one right there on our plates, sugar. It causes something called glycation. Basically, sugar molecules damage collagen and elastin, directly contributes to wrinkles.
Glycation. Okay.
Beyond sugar, general poor diet choices, lots of junk food, processed stuff, trans fats, they definitely speed things up. And weirdly, maybe, super low-fat diets aren't great either. Skin needs fat. It's mostly protein and fat.
Good point.
Then there are those inflammatory oils, the industrialized seed oils, soy, corn, canola, cottonseed, safflower, sunflower. They're high in omega-6, super inflammatory, and they can actually get stuck in your skin cell membranes for years. Leads to flaky, dry, red skin sometimes.
Wow, for years.
Yeah. And then, of course, stress. Chronic stress and tension are major aging factors. Lack of sleep, too. Your body needs that rest to repair. Alcohol doesn't help either. And finally, nutrient deficiencies, like not enough vitamin D, can really show up on your skin.
Okay, wow. Sun, sugar, stress, seed oils.
Yeah.
It feels like a lot to manage.
Yeah.
So what does this all mean for us? What can we actually do at home, starting now, to help our skin out?
Right. It can feel overwhelming, but the key is a holistic approach, balancing outside care with inside health. So, basics first. Hydration and protection. Moisturize regularly, morning and night. And ointments are often better than lotions, thicker, more protective. Look for at least SPF 15, but ideally 30. Even cheap drugstore ones work. Just be consistent.
SPF even in moisturizer, okay?
Absolutely. Then, internal hydration. Drink water. Lots of it, like 8-10 glasses a day. Coconut water, fresh juices are good too. Water-rich fruits, watermelon, bananas, great. And what to avoid in creams? Alcohol, petroleum stuff, mineral oil, those high omega-6 oils we mentioned. They can actually dry skin out.
Right. Counterintuitive.
Yeah. And maybe consider a shower filter can make a surprising difference. And sun protection, non-negotiable. Broad-spectrum sunscreen, SPF 30 plus. Sunglasses, wide-brimmed hat. Even on cloudy days.
Even cloudy days, got it.
And wear gloves. Protect your hands from water, chemicals, and, like we said, quitting smoking, limiting alcohol, big impact.
Those are solid daily habits. What about specific ingredients or supplements? Are there any real powerhouses we can add to give our skin an extra boost?
Oh, yeah, definitely. Let's talk about some standouts. Castor oil. Some people actually call it nature's Botox. It's pretty cool. It has ricinoleic acid, which penetrates deep and traps moisture. Plus, it's anti-inflammatory, antimicrobial, offers some UV protection, helps with dark spots, and might even boost collagen.
Wow. How do you use it?
Just a few drops at night. Make sure it's cold-pressed, hexane-free, organic. Some say Jamaican black castor oil is even better. Great for hair and lashes, too. Just a warning, pregnant women should avoid it near the abdomen. Might induce labor.
Good to know. I hear loads about hyaluronic acid, too. That's everywhere in skincare. How does that fit in?
Hyaluronic acid, yeah, it's a superstar for a reason. It's naturally in our skin and joints. Its amazing thing is holding like 1,000 times its weight in water.
1,000 times.
Incredible, right?
Right.
But our levels drop as we age, so you can apply it topically. Pro tip, wet your hands before applying it. Helps it grab moisture, or you can take it as a supplement. Around 200 milligrams a day is a common dose, helps avoid too much swelling.
Okay. Any other less common, maybe more traditional things?
Definitely. How about tallow? Grass-fed beef fat? Sounds weird, maybe.
A little.
But its chemistry is super similar to our skin's own oil, sebum. It's packed with vitamins A, D, E, K, CLA. Doesn't oxidize skin, less greasy than coconut oil, actually, and can help with dark spots, wrinkles.
Interesting. Tallow.
Okay. And coconut oil, of course. Great natural moisturizer, fills in tiny gaps, makes skin look plump, anti-inflammatory, too. For internal help, see buckthorn berry powder. It's an Ayurvedic thing loaded with antioxidants, vitamins, minerals. Helps boost collagen from the inside, usually taken like a spoon in milk or warm water before bed.
Sea buckthorn. Got it.
And lastly, maybe beta carotene. It's a precursor to vitamin A. Supplementing can help protect skin from UV damage from within.
So it really hammers home that it's not just what we put on our skin, but what we eat.
Yeah.
What are the absolute must-dos for diet and vitamins?
Totally. Diet is key. Number one, limit sugar. Seriously, that glycation process is so damaging. Cut back on sugary foods, drinks. Instead, focus on nutrient-dense foods, fruits, vegetables, especially things rich in vitamin A that boosts collagen. Think sweet potatoes, carrots, broccoli, spinach, leafy greens.
Vitamin A for collagen. Check.
Vitamin C is crucial too, prevents early wrinkles, dryness, so citrus fruits, lemons, oranges, amla, berries, strawberries, blueberries, don't forget vitamin D, prevents skin damage. Get some early morning sun or find it in milk, soy milk, yogurt, mushrooms.
Vitamin D, okay.
And finally, healthy fats. Ditch the low-fat craze and those processed omega-6 oils. Focus on good fats, omega-3's fish oils, cod liver oil. Your skin needs them.
Makes sense. What about other routines like exfoliating or even exercising facial muscles? Does that stuff actually do anything?
It can, yes. Gentle exfoliation, maybe once or twice a week. Really good. Removes dead cells, stimulates collagen. You can even use natural stuff like avocado. It has some glycolic acid, gives a gentle boost.
Avocado exfoliation. Interesting. And facial exercises.
Yeah, facial exercises can help tone the muscles underneath, like for eyes, lifting brows, looking down, closing, opening, looking left, close open, right, close open, strengthens eyelids, or squeezing eyes shut tight, then opening wide. For cheeks, smiling with lips closed, lifting cheeks up, cheek lifts, forehead, pull down gently with fingertips while raising brows, jawline. Tilt head back, push lower jaw forward. The idea is better muscle tone, more circulation, maybe more collagen support.
And hands. You mentioned hands age too.
Right. Simple things like clenching fists tightly, pressing acupressure points, then releasing, boosts blood flow. Wrist rotation, the stretches like backward namaste can help too, especially with all our phone use causing strain.
What's fascinating here is how simple some of these can be, using ingredients we probably already have. Instead of just listing recipes, let's talk about the types of kitchen remedies that work, based on what we know about skin.
Exactly. So many good things are right in the kitchen, like protein-rich masks. Eggs are great for this. Egg whites give a nice temporary tightening effect because of the vitamins. Just massage it on, leave 20 minutes, rinse. Simple.
Quick lift.
Yeah. Or the yolk, it's richer in fats, vitamins, better for nourishment, supporting the skin barrier. Some people prefer the yolk for moisture. Then you have fruit-based stuff, packed with antioxidants, vitamins. Like strawberries, mash them up with egg white. The ellagic acid is great for antioxidants, collagen boost. Bananas are amazing for hydration, vitamin A, C, B6. You could mash a banana with aloe vera, maybe some olive oil for a super hydrating hand mask.
Nice. And you mentioned potatoes earlier. Seems unlikely, but you said they work.
Oh, potatoes are surprisingly awesome for skin. They have catecholase, helps lighten dark spots. They're cooling, reduce puffiness. Antioxidants fight free radicals. And the starch and enzymes give gentle exfoliation.
Who knew?
Right. You can blend potato with water to make a base, then mix it with other things, like milk for brightening, or even cinnamon stimulates circulation, can smooth wrinkles. Apply to face, neck, hands. We'll definitely put more specific recipes in the show notes for people to check out.
Okay, great. So eggs, fruits, potatoes.
Yeah.
Any other kitchen staples?
Yeah, a few others. Flaxseed ground up, mixed with Greek yogurt and honey. Those fatty acids lock in moisture. Coffee grounds, the unused ones. Mixed with milk into a paste. Great for toning, exfoliating.
Coffee scrub. Okay.
And cocoa powder. Mix it with coconut oil, Greek yogurt. Antioxidant rich, removes dead cells, soothing, good for face, neck, chest, even a simple cleanser. Brown rice flour mixed with rice milk or water. Gentle, has vitamin E, calcium, nice and soothing.
That's a fantastic range of natural options.
Yeah.
Now let's shift gears. If we connect this back to the bigger picture for people looking for maybe more dramatic or targeted results, what does the professional world offer beyond what we can do at home?
Right. When you get into professional treatments, especially for tricky things like jowls, it's usually a much more involved approach. First, let's be real about at-home devices. Facial massagers, jade rollers, gua sha. They feel nice, help with lymphatic drainage, reduce puffiness temporarily, like or an hour or two. They don't fix underlying sagging.
Okay, temporary relief.
Exactly. Same with microcurrent devices like NuFace or Zip. They use tiny electrical currents, stimulate muscles, maybe improve circulation a bit. They might promote some collagen over time, reduce temporary fluid. But the benefits, they pretty much last only as long as you keep using the device constantly. Stop using it, things tend to go back within an hour or so.
So not a permanent fix either. For more lasting change, it's in-office treatments. And you said it's usually not just one thing.
Almost never just one thing for really natural, significant results. It needs that multifocal approach because aging hits on multiple levels. Fillers are a cornerstone. They restore lost volume, create a sort of optical illusion of lift. But you need a really skilled provider. Someone who understands facial proportions, uses the right type of filler for the right area, like a denser one for the jawline versus something softer elsewhere.
Registry matters there.
Hugely. Then there are collagen stimulants like Sculptra. These aren't just filling space, they actually trigger your own body to make more collagen. Great for overall volume loss, skin laxity, especially mid-face. Temples. If you don't need volume, just tightening, there are skin tightening procedures using ultrasound like Hall therapy or radiofrequency heat. They contract and tighten the skin itself, often done periodically, maybe L therapy every year and a half, 2 years.
Okay, tightening without adding volume. Makes
Right.
sense. What about microneedling or those threads people talk about?
Microneedling creates tiny, controlled injuries. The skin heals, promoting resurfacing, helping with fine lines, texture. Light treatments, maybe once or twice a year, can be quite effective. Threads are interesting. They're dissolvable sutures put under the skin to physically lift it in certain directions.
Physical lift.
Initially, yes, you get some instant lift, lasts maybe a couple of weeks. But the main idea is as the thread dissolves, your body builds collagen, basically. Targeted scar tissue around where the thread was, creating longer-term firmness. Just a note, probably not great to do them constantly if you might want a facelift later. The scar tissue could potentially interfere.
Good point. And faceless themselves.
Well, facelifts are obviously a major surgery. And even with the best surgeons, jowls are notoriously hard to fix completely and permanently. Often, that's the first place sagging might reappear. It just shows how complex that area is.
So lots of options, home and pro, but clearly lots of details matter. What are the big takeaways or maybe red flags people should really watch out for?
The biggest thing is avoid thinking there's a single magic bullet. Effective treatment, especially professional stuff, needs a tailored plan. Multiple ingredients, maybe multiple procedures, based on your specific anatomy and goals.
No one size fits all.
Absolutely not. And choosing your provider. Go with someone whose aesthetic results you genuinely like and trust. Don't just chase discounts. The skill of the person doing the treatment is everything.
Right. Trust the eye, not just the price.
Exactly. And one specific red flag, especially for younger people, buccal fat removal. Removing that cheek fat. Strongly advised against by many experts now. It takes away crucial volume and can actually make you look older faster and lead to more sagging down the line.
Wow, okay. Avoid that unless absolutely necessary.
Pretty much. Ultimately, understanding why your skin is changing the root causes of wrinkles or jowls helps you choose the right path and avoid wasting time and money, or worse, doing something harmful.
This really brings up a key question for you listening. With all this information, what's maybe the most important thing to remember when navigating the world of anti-aging?
I think it boils down to this. Youthful-looking skin is really an outward sign of consistent internal health working together with smart external care. It's not a one-time fix, it's a journey. Learning, adapting as your skin changes. The best approach is balanced integrating those simple daily habits we talked about, and then, if and when it feels right for you, making really informed choices about any bigger steps or treatments.
That's great advice. It's about empowering yourself with the knowledge, right? Seeing skincare not just as vanity, but as part of overall well-being. So maybe a final thought for you to consider. How might prioritizing those truly natural remedies and lifestyle habits give you more sustainable long-term benefits for aging gracefully, compared to maybe chasing the latest trend or super complex fixes? What does aging gracefully really mean to you, and how can figuring that out help guide your choices? Thank you for being with us until the end of this video. Please be sure to subscribe to the What Does Science Say channel and give us energy with your likes and comments. Share your comments with us and send the video to your loved ones so that others can see this.